Acumed's locking olecranon plates provide excellent fixation for both fractures and osteotomies. The plates feature an advanced anatomic design with contours proximally and along the shaft to provide a precise anatomic fit as well as a lower profile design. An improved locking screw trajectory allows screws to be angled to capture fracture fragments and to avoid other locking screws regardless of the screw length selected. Increased plate length range makes this olecranon plate system the most comprehensive plate offering on the market. A radiolucent targeting guide for the proximal 2.7 mm screw cluster eases the surgical technique and other instrumentation improvements, including an osteotomy cutting jig, provide innovative features unique to Acumed's system. The Acumed elbow plating system offers many key improvements, including the hexalobe screw system. The following surgical technique describes fixation of a distal humerus fracture with Acumed's parallel plating system and hexalobe screws. The articular fragments, which tend to be rotated toward each other in the axial plane, are reduced anatomically and provisionally held with .045 smooth K-wires. It is essential that the K-wires be placed close to the subchondral level to avoid interference with later screw placement, and away from where the plates will be placed on the lateral and medial columns. One or two strategically placed K-wires can then be used to provisionally hold the distal fragments in alignment with the humeral shaft. After positioning the targeted drill guide, tighten the 2.3 mm cannula against the plate hole prior to drilling. Insert a 2 mm K-wire through hole number 2, numbered from distal to proximal, of each plate. Leave these K-wires in place as they reserve a location for screws in a later step. A non-locking 3.5 or 3.0 mm bicortical hexalobe screw is inserted into a slotted hole proximal to the fracture site on the medial and lateral side of the humeral shaft. Non-locking screws are inserted in the most distal hole of each plate. Most often 3.5 mm screws are selected. In dense bone, it may be necessary to tap the bone prior to screw insertion with the appropriate bone tap included in the system. To compress the lateral column, secure the large bone clamp to a screw head slightly loosened in the shaft on the medial side. The opposing end of the clamp should be placed behind the distal K-wires. With a slightly loosened screw in the lateral plate, the bone clamp is squeezed to compress the lateral column. At this time, the medial column may slightly distract, but will be addressed in the next step. Insert and fully tighten a screw in the lateral plate, proximal to the fracture, in dynamic compression mode. Remove the large bone clamp and compress the medial column in the same manner. After compressing both columns, firmly tighten all 4 shaft screws. After supracondylar compression has been achieved, the distal variable angle locking screws are inserted. The distal holes containing the 2.0 mm K-wires will be utilized for insertion of the variable angle locking screws. If using a 3.5 mm locking screw, drill with a 2.8 mm drill in the path of the K-wire. If a 3 mm locking screw is used, drill with a 2.3 mm drill. To install the locking screws, a plate tap is selected based on the diameter of the drill used. There are separate taps for 3 mm and 3.5 mm locking screws. The front end of the tap will act as a guide to ensure that the locking screw follows the correct trajectory. After securing the tap to the T-handle, irrigate the drill hole prior to inserting the tap. Slowly tap the plate a quarter turn at a time, taking care not to insert the tap deeper than the laser band. The tap cutting flutes must remain engaged into the threads as they cut into plate to decrease the risk of cross-threading upon tap removal. There are several important points to keep in mind while using variable angle tap lock technology. Clean the tap after tapping each hole. Do not tap a compression slot or re-tap a hole. Plates must be tapped by hand and not under power. Note that the tapped angle must be within a 20-degree angle from the plate for the locking screw to fully engage. If excessive resistance is met while inserting the tap, stop, remove the tap, and discard. Acumed's taps are for single surgery use only. When tapping the plate, most of the titanium generated remains on the tap. Any remaining titanium should be removed from the surgical site. Insert the locking screw and fully seat into the plate. Do not over-tighten the screw. Insert a second locking screw in the lateral plate in the same manner. 2 locking screws are recommended distally, but each of the 6 distal holes can be tapped using tap lock technology. Locking screws may be inserted into the pre-threaded holes in the humeral shaft at the surgeon's discretion. Standard 3mm and 3.5mm locking drill guides are available in the system. Drill depth may be read directly off the laser band on the drill, or with the 2.3mm depth probe. Locking screws are inserted as the final step in plate placement.